Guidant presents the RX Accunet Embolic Protection System, designed for the capture and recovery of embolic material produced during interventional procedures in the carotid arteries. This presentation will include recommended techniques for delivery system preparation, filter basket delivery and deployment, and filter basket recovery. Additional materials required for use with the RX Accunet Embolic Protection System include a 6 French guiding sheath or 8 French guiding catheter, a 10 to 20 cc lure lock syringe, heparinized normal saline, and a rotating hemostatic valve. Delivery system preparation. Confirm that the RHV on the flush tool is loosened. Attach a 10 cc syringe with heparinized normal saline to the flush tool. Hold the dispenser hoop in an upright position. Flush gently to remove air from the filter basket. Confirm that no part of the light blue section of the delivery sheath is within the valve of the RHV. Then, tighten the RHV. Release the device from the attachment hooks on the dispensing hoop and remove it from the hoop by pulling on the flush tool. Make sure that when removing the device from the packaging hoop that you grip the delivery sheath to ensure that it is held within the flush tool. Flush again to remove all air from the sheath. Observe fluid exiting the proximal end of the delivery sheath. Slide the included torque device with the peel-away adapter onto the wire and up to the edge of the delivery sheath. Tighten the torque device onto the wire. While observing through the flush tool, grip the delivery sheath and pull back on the torque device until the filter basket is completely within the distal end of the delivery sheath, such that the distal end of the delivery sheath is aligned with the proximal end of the dark blue filter basket obturator. Loosen the rotating hemostatic valve on the flush tool and remove the system. Then, reposition the torque device up to the proximal end of the delivery sheath and tighten it down onto the wire. The delivery system is now ready for use. Filter basket delivery and deployment. The RX Accunet guide wire tip may be shaped if necessary. Insert the tip of the wire into the introducer tool that is included with the delivery system. Insert the introducer tool and delivery system through the hemostatic valve and guiding catheter or long sheath, ensuring that the funnel of the introducer tool is not within the valve. Advance the delivery system through the hemostatic valve until the delivery system has entered the guiding catheter or long sheath. Remove the introducer tool from the hemostatic valve and tighten down the valve if necessary. You would typically remove the introducer after 5 to 10 centimeters of the delivery system is in the sheath. Advance the delivery system into the desired vessel. The guide wire rotates independently from the filter basket and delivery sheath. Therefore, it is important to steer the guide wire tip with the torque device. Do not torque the delivery sheath. Using the radiopaque guide wire tip, 4 filter basket markers, and the proximal bushing for reference, position the delivery system so that the filter basket is distal to the target lesion and will not interfere with the devices to be used for lesion intervention. Under fluoroscopy, ensure that the radiopaque tip of the guiding catheter or sheath, target lesion, filter basket, and distal wire are continually in the field of view. Note: confirm that the guiding catheter or sheath is well positioned and firmly seated at all times throughout the procedure to minimize the likelihood of the guiding catheter or sheath backing out or prolapsing into the aortic arch. Warning: allow and maintain adequate distance between the radiopaque proximal bushing marker on the filter and the distal end of the desired stent position to avoid stent deployment or entanglement on any part of the filter. Once the delivery system is in the desired position, you can prepare it for deployment. First, loosen the torque device and slide it proximally about 1 centimeter. Then, lift the light blue proximal end of the delivery sheath off the wire. This portion of the sheath has a preformed split in the polymer. Thread the light blue polymer through the side hole of the peel-away adapter on the torque device until the tip of the collet tube is at the position where the delivery sheath splits off from the guide wire. Tighten down the torque device firmly onto the wire. Remove all slack from the delivery system and stabilize the torque device with one hand. With the other hand, grasp the proximal end of the delivery sheath and pull in a horizontal direction away from the patient. This will cause the delivery sheath to peel away at the adapter. Under fluoroscopy, observe the filter basket deployment. Continue to pull horizontally on the delivery sheath until the distal blue section of the sheath exits the hemostasis valve. Loosen the torque device. Remove the torque device and delivery sheath from the wire by sliding them proximally off the end of the wire. The filter basket wire may now be used to deliver 14/1000ths of an inch compatible interventional devices. During subsequent balloon and stent manipulations, always keep the open filter basket distal to the deployed stent. Never pull an expanded filter into the lesion or stent area. Remember, maintain the radiopaque tip of the guiding catheter or sheath, target lesion, and filter basket in the field of view, and ensure that the guide catheter or sheath is securely seated at all times. Filter basket recovery. Multiple recovery catheters offer patient-specific options. There are 2 dedicated recovery catheters packaged in the Accunet system. The RX Accunet 2 recovery catheter has a lower profile, more flexible tip, and a more flexible catheter shaft, while the original recovery catheter has a shapeable tip that can be steered away from stent struts during advancement. Remove your choice of recovery catheter from the dispenser hoop and flush the distal end using either a syringe or the flush tool. Observe fluid exiting from the RX notch. Both recovery catheters are prepped the same way. The distal 2 to 3 centimeters of the original recovery catheter can be shaped if necessary to deflect the catheter tip away from stent struts. Backload the chosen recovery catheter over the wire and advance until the tip of the device meets the radiopaque proximal bushing of the filter basket. A variety of techniques can be used to assist passage of the recovery catheter if it has difficulty advancing through the deployed stent. Some options are: have the patient rotate his or her neck from side to side. Change the position of the guiding catheter or guiding sheath. If using the shapeable tip recovery catheter, modify the tip shape. Post-dilate the stent. Insert a guide wire as a buddy wire to straighten the stented area. Use the alternate recovery catheter. While holding tension on the guide wire, advance the recovery catheter until the 4 basket markers come together. Do not attempt to capture the filter basket by pulling it into the recovery catheter if the recovery catheter tip is in the stent area. Constraining the basket markers within the tip of the recovery catheter is all that is needed to safely recover the filter basket. Note: the filter basket should not be completely contained within the recovery catheter. With the RHV fully open, securely hold both the filter basket wire and the recovery catheter together as a unit, and slowly pull the system proximally into the guiding catheter or sheath and remove from the body. Note: if using a Guidant Copilot bleedback control valve, ensure that the copilot is held open while the filter basket is removed. Note: if the wire and catheter are not retracted in unison, the filter basket may redeploy. Once the procedure is complete, make sure to discard any unused recovery catheter. Do not stockpile unused recovery catheters, as they may be sized to the specific filter basket being used, and there is no expiration date on or within either recovery catheter pouch. The RX Accunet Embolic Protection System, designed for the capture and recovery of embolic material produced during interventional procedures in the carotid arteries. Guidant.